Hello, everybody. I'm Dr. Jolie. I'm a urologist in Singapore. My clinic is at Mount Elizabeth Novena Hospital and Mount Alvernia Hospital. I look after patients with kidney problems, prostate problems, and other urological conditions.
Thank you for having us today, Dr. Jolie. Dr. Lee, if I have a patient that was diagnosed with a kidney stone, they ask whether is it okay to wait for the kidney stone and don't do anything?
Mm. Okay, that's a good question. So, if you have been diagnosed with a kidney stone, right, your question is, can I wait or should I not, right? So the honest answer is sometimes you can wait, but not always. So why do I say that? It really depends on what kind of stones, how big or how small are the stones. The size of the stone matters because small stones can pass out on their own sometimes, es- especially if they are already in the urinary tube. All right. Especially if there's no underlying infection, there's no blockages that affects the kidney, and the pain is controlled. You can wait. We can urologist will give some medication, all right, to help you pass the stone. However, waiting is not the same as ignoring or forgetting about the problem, because a kidney stone, when it's big enough, can actually block the flow of urine from the kidney down the urine tube, the bladder. And when that happens, the pressure will build up in the kidney. The kidney becomes very swollen, a condition we call hydronephrosis. And if hydronephrosis is not treated in time, it can actually lead to permanent damage to the kidney, and the kidney can lose its function. That is why I say that yes, sometimes you can wait, but not all the time. The other thing is when a stone is moving down the ureter, it can be quite painful. Some patients describe the pain as being worse than having a child. That is why passing a stone can be very painful. We call it ureteric colic. So many patients describe the pain as worse than that of childbirth. The danger is this: sometimes the pain may settle, but the blockage caused by the stone is still there. When the stone is moving, a person experiences pain. But when the stone is stuck and not moving anymore, sometimes the pain goes away, and this gives the patient a false sense of security, thinking that everything is okay. Yep.
Is there a time limit where when you have kidney stone pain that you need to go to the hospital, or you can actually wait another day?
Yes, all this depends on how severe is the pain. A patient who has a small stone, sometimes what they feel is that a bit of cramps on and off, usually in the flank area, which is where the kidneys are located, depending on the how severe the pain is. If the pain is bearable, some patients may wait a day before they go see a doctor. But in very intense uterine colic, the pain can be so severe that it is unbearable. Patient can hardly stay still. Now, in this kind of situation, what they need is actually adequate pain relief, and this has to be achieved by seeing a doctor, either in the clinic if it's available. If not, will be at the hospital in the emergency setting.
Dr. Lee, how do we know the type of stone that we have?
Well, to know the type of stone, proper evaluation will be required. And for urinary stones as a whole, imaging such as CT scan, ultrasound, X-ray, all these will be very useful tools to tell us, number one, what is the location of the stone? Is it in the kidney? Is it in the ureter or the urinary tube? Or is it down towards the bladder? The other way is to let me see. I just mentioned. Sorry, I just not mentioned the location of the stone, right? Okay. So your question just now was what's the
How to know?
how to know, right? By imaging, right? Yeah. Okay. Um, Yeah, so imaging will tell us the location of the stone. The other thing that imaging can tell us is the size of the stone and how likely is it going to cause a blockage and how should we deal with the stone.
Thank you so much, Dr. Lee, for the information that you've given.